The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everybody, this is Jonathan Marks. Welcome back to another show of Go to Health Media. How are you today? You can watch us on YouTube, you can listen to us on podcast, and you can also watch us on our website at gotohealthmedia.com. We're going to be showing some photos during this show, so you might want to watch the video. Are you 50 years or older, and did you ever have chickenpox as a kid? Well, if you did, and if you are, listen up because this show's for you. According to the CDC, 1 in 3 people will develop shingles, a painful skin condition. If you've had chickenpox, the virus that causes shingles is already inside your body. Shingles can be a painful and isolating experience, leading to rashes, blisters, and scabs, especially on the face, that may take several weeks to heal. The virus is more common in older adults. February 24th through March 2nd, 2025 is Shingles Awareness Week. And when you see some of the photos of what shingles look like on your face and how it disrupts your life and hear the story of today's guest, you're going to want to be more aware of shingles. 99% of adults in the US had chickenpox as a child. And although not everyone will develop shingles, the virus can reactivate at any time. And the risk increases as your immune system naturally declines with age, and your risk increases as your immune system is weakened by other health problems such as diabetes, COPD, heart disease, and asthma. Our purpose today is to educate you about shingles and help you avoid it in one way, with the shingles vaccine. You're going to want to talk with your doctor or your pharmacist about your risks and how to protect yourself. With us to talk about this today is a lovely woman named Larnie. She is a nurse and a mother, young and healthy, and shingles caught her off guard at a most unexpected time, just as she was landing in Hawaii for a week's vacation. Can you imagine that? She was in the hospital almost the whole time. She is passionate about sharing her story to ensure people understand their risk for shingles. Also with us today is Dr. Curry Winchell, who is a family medicine physician and spokesperson for GlaxoSmithKline. Her advocacy is dedicated to improving health, literacy, and equity, and we did a recent show on why DEI is so important in healthcare. Dr. Curry Winchell is featured frequently on broadcasts like NBC, CBS, Scripps News, and the BBC and CNN as well. She has partnered with GSK's Thrive 50 Plus campaign to raise awareness about the risk for shingles in those 50 years and older. Welcome to the show, Dr. Bio and Larnie. How are you today?
Thank you, Jonathan. Thank you for having us.
Good. So, Dr. Bio, what is shingles and how is it caused? Explain that to us.
Shingles is caused by the virus varicella zoster. It's the same virus as chickenpox, which lies dormant in the spine and can reactivate at any period of time.
Good. And why are people at 50 more at risk? I understand that's the age when people typically get it.
It is. So at age 50, your immune system starts to decline, which can increase your risk for developing shingles.
And Larnie, can you tell us about your experience with shingles? What happened to you? And I know that was quite a dramatic story. So if you could share that with us, that'd be great.
Yes, and again, thank you for this opportunity, allowing me to share my story. So my family and I were on a much awaited vacation to Hawaii. And during the flight, I noticed bumps on my forehead on the left side. And during the duration of the flight, this growth had grown. And by the end of the flight, my husband and I decided to go to urgent care. And at urgent care, the provider there recommended I actually go to the ER. because the concern was this growth was happening near my eye.
Mm.
And so in the ER with the team of providers there, they asked me questions and they diagnosed me with shingles.
And what happened after that? What kind of treatment did you get?
Yeah, so it was a specific treatment. I was hospitalized for 8 days. Now, I don't have a typical case. However, this experience, being hospitalized and just this experience has really, not only physically impacted my life, but also, psychologically. And it totally disrupted my vacation.
Yeah, aside from ruining the vacation, tell us about the effects this disease had on you.
Yeah, so I mean, on my mental health, especially, for the first 6 months, it was a physical toll because it was the bumps, it was the scabs, it was the falling off of the scabs, and then and all I kept thinking was, is this going to be forever? And that's what just kept coming, to my mind. And also for me, again, not a typical case, but it was near my eye, and it
Mhm.
really put like a spotlight on my health and the value of health and the coming down with this particular illness was really just surprising because I did not expect it at all. I'm young, I'm healthy, I'm active, and I never thought it would happen to me.
I'm certainly glad you're telling your story today. Dr. Bio, tell us what is the treatment for shingles if you get it? And how long does shingles last if you get it?
So it's very important to have a conversation with your doctor or pharmacist. All of us have different health journeys. And when you have that conversation, it really helps paint a picture of your potential risk for developing shingles. In that conversation, you'll have other discussions and talking about other treatments and other factors. But starting off with what are my potential risks for developing shingles is the first step that you can do to invest in your health.
Got it. And what is the treatment if you do get it?
So it varies. Each patient is an individual. And so for me, when I see a patient in my clinic, I really take note of their health history. I take note of other medications that they may be taking. The other thing that I really like to focus on, especially with the new data that has come out, that if my patient has heart disease, COPD, diabetes, or asthma, I know that there's an increased risk of them developing shingles.
And is that because of more tax on the immune system?
It is. It's a combination. So we do know over the age of 50 that your immune system starts to decline. However, if you have, one of the conditions that I mentioned, that can also be stressful on the immune system. So the two together can increase your risk for developing shingles.
Got it. And people can learn more if they go to easyvax.com. That's easy and then vax.com. Dr. Bio, let's talk about the vaccination. What what does it take to get it? And tell us what the side effects. And I think the biggest question most people have is it's safe.
Every person has to really think about how they want to move forward with their health journey. And one safe spot to do it is to have that conversation with your doctor, with your pharmacist, and also checking easyvax.com. All of those things are really important to really answer those questions, answer those questions.
So, are there risks to getting the vaccine? What kind of responses can people get?
So, with every single person, we all have different health histories.
Okay.
And that's where I take the time with my patients personally to really look at your health history. I look at the medications that you're taking, and I lean into curiosity of what are your concerns? What are your thoughts? What kind of questions do you have about what treatment you may want? And I think if every clinician can do that, and then every patient can come in and also be able to have those questions, that's where we're able to really provide the best care possible. And I can just personally tell you that's what I do in my clinic. And that's why each decision that I make medically is based on the person that I get to see. And so that's why I answer that question the way I do.
Good. I've asked you some specifics there, but I'm really hearing from you a couple of times that you really should be talking with your doctor or pharmacist personally so that they understand your health condition background, what medications you're on, and then they can work out the best regimen for you. Do I have that
Yeah,
correct?
you do. I
Good.
like to say we, it's not a one size fits all. I don't practice that way.
Got
I
it.
practice based on who is in front of me, what they would like to know, what things are concerning to them. That for me is why I became a doctor, and that's what I lean into.
Yeah, so Larnie, let me ask you, now that you've gotten through your shingles episode, are there ramifications in your life that remain?
Yes, it stays, on top of mind because it is my health
Yes.
and, how I take control of my health journey. And one of the ways that I found powerful is to talk to my provider about, my health. And if anything coming, the message I share with everyone, especially if you are over the age of 50, is to talk to your provider or pharmacist about your risk for shingles and about vaccination.
Got it.
That's
And
really
s-
important.
and so give me a final message that you really want to leave with our listeners, Larnie. What message do you want them to hear and remember?
My message is take value of your health, prioritize your health, and really invest in your health. It's your health, it's your journey. And I'm going to say it again is especially if you're over the age of 50 is talk to your doctor or pharmacist about your risk for shingles.
Thank you so much. And Dr. Bio, let me ask you, I know that you're an advocate for improving health literacy and equity.
Yes.
Can you define for us what health equity is? Because that's a kind of a new term that's coming online, and I want people to understand more about that. What do we mean when we say health equity?
It's the ability, Jonathan, to access health information in a way that is in tune to your literacy, in tune to how you like to digest information, and also having access to that information. And beyond that is are you able to do something when you get that information and put it forward to your health? So, when we talk about health equity, it is having equitable access, treatment, information, all of those areas in a wraparound service in order to have the best health outcome possible.
Good. Thank you for sharing that with us. Thank you to both of you for being with us today to talk about shingles. Dr. Bio Curry Winchell and Larnie, who has had shingles. It's such an important message to get out. Remember, if you're over 50 and you had chickenpox, the virus is already in you. You want to be making sure you talk with your doctor or your pharmacist about the best treatment or next steps for you. Thank you for being with us again today. Remember, you can see us on YouTube, on our website at Go to Health Media, and also on 8 podcast networks. This is Jonathan Marks with Go to Health Media. And remember, as we say at the end of every show, go to health. Take care. God bless. Thanks again for being with us, folks. Bye bye. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.